Guys, so this is just a quick guide because hindi ta mo matiis, and I know abnormal psych is pretty challenging. So for the introductory topics, just to give you an overview and to help guide you how you're going to approach studying the other families of disorder. Sige, let's do this, no? Sige. So what is abnormal psychology? What is this in the first place? So it's a scientific study of abnormal behavior undertaken to describe. So we want to be able to describe, predict, explain, and change abnormal patterns of functioning. So that means when we're studying abnormal psychology, we're looking at these 4 goals of psych, which are all very familiar to you because these have been discussed na in Gen Psych pa, diba? So first, we want to be able to describe. What do we mean by that? So when we describe something, that means we want to look at what are the symptoms, the signs and the symptoms we need to see a person experiencing in order for us to say that the person is experiencing or has a particular psychological disorder. Next, we want to be able to predict. So part of this is understanding what is the extent nag-occur ang disorder in the population. Does it occur more in males or females or those with particular histories? So here we are talking about epidemiology, diba? In the sciences and the medical studies, epidemiology. So we look at, does this happen more sa young adults or sa middle-aged people, or is this more common in males than in females, or if it's particularly common in specific na races or ethnicity, so on and so forth. Okay? And then next is we need to be able to explain. So here we are talking about etiology. What is the origin of the particular disorder? So, of course, here pa lang, right off the bat, I'd like to clarify that for a lot of psychological disorders, we don't have parang one definitive explanation for where that comes from. Usually, it's a combination of a lot of things aggravating the situation. Okay? So, yeah, but that's it. And then, of course, we also want to be able to change abnormal patterns of functioning. So that means we're also going to look at treatments. What are the treatments used by medical and mental health professionals to help improve the conditions of those with psychological disorders? Okay? So, yeah. Sige. Let's go. So, here is the topic outline. So, for prelims, para patikim again. And so, we have a clear understanding of what we're getting into before we look at the specific disorders. We are going to study the introduction and history. But I'm not gonna make a video on the history na. So, that's really more just of reading up on the story of abnormal psych. So, that's on you na. And then, we're going to look at the multidimensional approaches. And this is very important because if we're going to study etiology and treatments, we need to understand what are the different perspectives. Now, if you remember in Gen Psych, we've already explored the different perspectives. Diba? May genetic, may biological, may behavioral, cognitive, psychodynamic, sociocultural, so on, diba? So on. So here we're going to look at that, but specifically in the context of abnormal behaviors. Okay? And then we are going to look at different ways by which we can perform clinical assessment. So actually, you're not gonna do this. This is for psychologists and psychologists in training. But as future psychometricians or as future medical professionals, it would be helpful if you also have an idea of what are the tools and techniques that are useful. And then after that, we are going to jump straight into the schizophrenia spectrum. So in the Philippines, this family of disorders, one of the most common, perhaps actually even the most highly reported, although baka ma-overtake siya ng mood disorders, particularly depression. But right now, this is it. Okay? And then for midterms, we are going to look at anxiety and stress-related disorders, and then OC, and impulse control disorders and mood disorders, so on and so forth. Okay, so yeah. So what is a psychological disorder? Since this SEM is all about disorders, okay? So when we study a psychological disorder, we say that it is a psychological dysfunction within an individual, and it is associated with distress or impairment in functioning and a response that is not typical or culturally expected. Okay? So, another slightly different but similar din naman ang main idea na definition is that it's a behavioral, psychological, or biological dysfunction. So, we look at what is the person's way of behaving, and we know that it's not functional, meaning it's not adaptive. And we look at the psychological functioning, so meaning yung thought patterns niya, and then the biological also, okay, that are unexpected in their cultural context. So it is different, okay? It's different and associated with present distress and impairment. So distress meaning the person is bothered or the people around him are bothered for him. And there is impairment. So when we say impairment, that means the person cannot perform the things that he or she should be able to perform in that point in his life or possibly in the past, or hindi niya pwede ma-perform in the future, for example. So work, learning, so that can be in the school setting, in the occupational setting, or in family life, or in his or her social life. And of course, there is an increased risk of suffering death and pain or impairment. So this is where danger comes in. So for example, there is a risk na mag-attempt mag-suicide yung person, or if there is a risk that the person may harm other people in his or her home or in other places. Okay? So that's what a psychological disorder is. And if you look at the criteria niya, you can break that down into what we call the 4 Ds. So the first one is deviance. So it's atypical or not culturally expected. Now, that's quite a simple definition, but if you think about it, it can be very tricky to determine because we have norms, and those norms tend to be different depending on the culture. Okay? So there are expected behaviors of you, but they're not necessarily written in paper. They're like, oh, you can do this or you don't do this, etc., etc. So there are certain behaviors. Like for example, if you see somebody always laughing on his own and talking on his own, that's not something that's pretty common na ginagawa ng tao, at least in our setting, no? And it's deviant, it's different, but is it dysfunctional? Is it a problem? Diba? Does it harm the person or other people? Does it cause distress to the person or other people? So medyo kulang. So can it be considered a disorder or not? Right? Diba? So there's that question. Next naman is distress. So again, if the behavior or feelings experienced by the person cause him to feel upset, diba? Or the people around the person are experiencing distress as a result of what the patient is doing or saying, then there is distress. Next is dysfunction. So there is a breakdown in cognitive, emotional, or behavioral functioning. So for example, if every day you keep ending up in places where you shouldn't be. So let's say for example, you're supposed to be going to school, but then you snap out of something and then you're there standing outside Lipunan. Okay? Or you're there watching the river. Okay, sa may plaza. So parang, well, what happened? How did you even get there? Okay? So, if you cannot remember how you got there, diba? Or if maybe you were saying things you did not know you were saying, so there is a breakdown in your functioning. Okay? So, for example, also if your moods, or your emotions, your emotions, if you keep panicking in your room when there does not seem to be anything worth panicking about, and then you cannot control yourself, so you cannot self-soothe, okay, there might be dysfunction, diba? Okay? Or for example, if let's say you have a tendency to scratch your skin, such, I know a lot of us like do that from time to time, but there are people who like to do that to the point where they have wounds all over, they have scabs all over, they're bleeding all over. Clearly that is a problem, diba? Okay, so that is dysfunction. And the last, of course, is danger towards self, others, or property. So let's say if you put yourself in harm's way, so let's say for example, you are always drunk, and so when you are, and then you're driving pa from school or from work, so it puts you in danger. Or let's say for example, you think that other people are going to attack your house, and so you're always there locked up in your room, and you have prepared mga knives, and you say that anyone who comes near me in my room, I will stab him or her with my knife. So clearly you are a danger to other people. Okay, so that's also part of the criteria. Okay, so everything clear so far? Yay! Sige, sige. So we have a worksheet, so I'm not gonna go over this. I'm gonna jump straight to the next part. So what we're studying right now is called psychopathology. It's a scientific study of psychological disorders. So when we go back to the definition of abnormal psych and psychopathology, we're just rewording things, but that's basically what it is. We are studying the clinical description. What are the unique behaviors, thoughts, and feelings that make up a disorder? So here you're talking about describing the signs, the symptoms that make a disorder what it is. Next, we study etiology, the origins concerned with the biological, psychological, or social dimension. How does a person develop a particular disorder? What are the patterns? What are the histories that we need to see? And the last part is treatments. So what are the various treatments, okay, available for a particular disorder? What are the most effective treatments for specific disorders? And take note that when we say treatment, it's not the same as saying it's a cure. So that does not mean when you administer a treatment to a person, that condition is gonna go away in such a way na parang wala lang nangyari. Okay? That's not how treatments in psychopathology work. Okay? Now, another question you might have is that why is it called a disorder and not a disease? Because, diba, usually in medical terms, you refer to things as diseases. So, in a disease, mostly the orientation or the focus is organic, so body, physiological, and you are looking at structural changes. So, you're looking at, for example, clogged yung arteries. Okay, diba? So you have that elevated creatinine levels, diba? And they're usually measured using lab tests. Whereas in disorders, mostly we look at functional changes. Ano ang hindi kayang gawin? Anong nagkakaroon ng diferensya with the way the mind the way the person thinks, the way the person expresses emotions, or the way the person behaves in a certain way. And it's usually measured through behavioral tests, which are not confirmatory. Okay? So, not confirmatory meaning hindi siya ganun ka-precise. And then, for example, someone with a particular condition, for example, two people with depression may express their depressions very differently, although there are certain clinical criteria for you to qualify as having depression. So if you look at the comparison of a disease and disorder, you're gonna see an example of disease would be Down syndrome or Alzheimer's disease. But if you talk about the disorder, usually someone with Down syndrome has parang problems in intellectual functioning. So sometimes they don't develop the intellectual capabilities as fast as someone without Down's syndrome. So meaning they don't necessarily reach a certain level of intellectual development. So when we look at Down syndrome, yung concern natin in psych is the intellectual development. Okay, so intellectual development disorder, okay, versus the Down syndrome mismo. Okay? And then another one in Alzheimer's. So I'm pretty sure you're familiar with Alzheimer's, diba? A lot of you say, hala, when I grow old, baka magka-Alzheimer's. So in psych, we study dementia. So, dementia has to do with yung breakdown ng pag-function ng cognitive skills or cognitive abilities natin. And dementia can be caused by different things, one of which is Alzheimer's disease. Okay, so we're going to look at that in the pre-finals. Okay? Sige. Let's move on. Okay. Wow. So this is, what did I do with this? But anyway, so this is when you think about our disorders that we're studying, they're actually syndromes. They're combinations of signs. And these signs are objective based on the clinician's observations, and symptoms subjective, the patient's observations of what he or she is feeling and experiencing. Okay, so just added info. So kanina we were talking in psychopathology that part of what we're studying are treatments. So treatments, or in psych therapy, is a procedure designed to change abnormal behavior into more normal behavior. So we're just helping the person adjust the behavior niya to make it more normal. And usually when we say more normal, we are referring to the idea of making his behavior more adaptive. So how can we help the person function well and adapt well to the daily stresses, daily activities he or she needs to deal with in life? So here, the essential features are, of course, you should have a sufferer who seeks relief from a healer, diba? So if you don't have a client, what is treatment for? Next is that you should have a trained or socially acceptable healer whose expertise is accepted by the sufferer and his or her social group. So when you say trained, you're talking about licensure, clinical training and experience. And here's the other one, the tricky one, socially acceptable healer, whose expertise is accepted by the sufferer and his or her social group. So this is also why self-presentation relates to social psych. Self-presentation is very important, and the necessary credentials, but as well as rapport building. So, meaning, the sufferer should accept you as somebody who can help him or her improve his condition. Otherwise, diba, and that goes for his or her social group as well. So, very often, the family and the community. So, if they don't consider you a legit, quote-unquote, healer, then it's going to be very difficult for you to start the therapy or the treatment process in the first place. And of course, the last one is, aside from these people involved, there should be a series of contact between the healer and the sufferer, okay, where the goal is to produce changes in the sufferer's emotional state, attitudes, and behaviors. Okay, so yeah. So, of course, So, the goal is recovery. Okay, and when we say recovery, diba, again, we're not talking about a cure, we're talking about recovery. So, it's a process of change, and this is not a parang one-shot deal siya. Like, you go to therapy and then boom, that's it. Recovered na siya. Okay? It's really a process of change. And in this case, the idea is that you have to improve your health and wellness, particularly in different dimensions. Okay? One is in health. Okay? Another is in home. And this is where, diba, ideally, it should not just be the doctors working to improve someone's condition, nor should it be only the psychologist or the mental health professional or the social worker. They should be collaborating with each other and referring the patient to each other, because part of recovery is home, which is not necessarily a physical structure, but it should be a safe and stable place to live in. In the country, we don't have a lot of these, pero in the US and in other countries, what they have, for example, for the homeless, or those with history of drug or substance abuse, what they have is, an example of that is mga halfway home. So parang their buildings or their structures, and the patients live there, sometimes for free, and then eventually hinahanapan sila ng opportunities to have work. Okay, so, and this is the example of next. So, meaningful daily routine. So, work, social activities, okay, where they can participate in the things that, somebody without a disorder typically should be able to be part of. So they should have their own purpose. So sometimes they're given training, education, access to work, and of course, supportive social relationships that provide love, emotional availability, and respect. So very often for people with psychological disorders, this is also a main issue. And so when we are talking about recovery, diba, it's very hard for a patient to have to undergo therapy if all these other things are not addressed, because usually you don't just develop a psychological disorder in isolation, in a vacuum. Again, diba? It's really an interaction of a lot of things going on in your life. So very important, these things. Okay? So here are some other terminologies that are very important for you to learn, because you'll be using them, and then, for example, when I ask you things, or later on when you make psych reports for next sem's class, these are very important things. Okay, so the first one is presenting problem. So when you say presenting problem, this is the original complaint reported by the client. So this is from the perspective of the client to the therapist. So for example, panic attack, inability to sleep, inability to concentrate. Okay? So, and this is the thing here is that, like, let's say si Joy says, "Oh mom, I can't sleep 5 days na." Am I gonna say automatic, "Oh Joyce, insomnia, may insomnia ka girl"? Okay, so that's not necessarily how it's gonna work, because you don't just have one criterion for me to name a particular disorder and say, to diagnose, oh, this girl has this disorder. That's just one in many. So sometimes what happens is that yung presenting problem is just a minor concern compared to the actual condition of the person. So, for example, when the person says he or she cannot sleep, um, sometimes when you dig up using assessment, so you do interview, psych test, observation, among other things, you realize that there is a whole set of other conditions that the person is experiencing. And basically, may big condition siya, which is different from the original thing that brought him or her to you for consultation. Okay? So, yeah. So, another thing is differential diagnosis. So, in differential diagnosis, diba, remember, we start out with symptoms. And there are a lot of disorders na medyo may similarity ang symptoms. So, for example, if you say, for example, I'm feeling very sad. Parang wala akong ganang kumain. So let's say yun. Walang ganang kumain. Hindi na ako kumakain for 3 days. Okay? So, saan pwedeng mag-fit yun? Pwede kasi ang depression, diba? Changes in appetite. Now, sa depression, pag may depressive episode ka, it's also possible din na merong kang bipolar disorder. Kasi yung bipolar disorder, may manic na episode, may depressive episode. Or, depending on how long, what other symptoms you're experiencing, pwedeng persistent depressive disorder. So, or low-grade depression. Okay? Or, is that an eating disorder? Okay? Or is that because of an anxiety disorder? Bakit di ka makain? So, depending on your symptoms or combination of symptoms, there are a lot of possible disorders. So, what you do is you do differential diagnosis. So, parang you're analyzing the condition and seeing saan mas fit yung symptoms, yung signs and symptoms of the client. So, you can parang compare, contrast, and eliminate the disorders that are not as likely to be the condition experienced by your client. Okay? And the next is comorbidity. So, sometimes there are conditions na when you have this disorder, there is an increased likelihood na you also have this condition. So, an example of that would be anxiety and depression. So, they're very high ang comorbidity rate ng dalawa. So, parang more often than not, if you have this condition, you also have the other condition. Okay? So, another one, when we talk about terminologies in clinical description, we have what we call the prevalence and the incidence. So, here I made a little table to differentiate the two. Okay, so when we say prevalence, it's the proportion of the population with the disorder, and it is affected by your death rate and your recovery rate, and it is a measure of disease burden. So here's a table natin. You can see prevalence, okay, and for the month of April, you can see that there are 2 of them. So, both of them started to experience this disorder at this month. Okay, so the same with incidence. It's the proportion of new cases in the population within a specific time period. So, it's a measure of risk. So, for May, because you still have these 2 people who started out having the condition in April, for your prevalence, you have 2 pa rin. But because there are no new cases for May, di ba, wala, then your incidence is 0. Okay? So, sa incidence, remember, you only count kung ilan yung nagkaroon for that period. So, for example, if you're talking about the whole of April or the whole of May, then you count sinong nag-start magkaroon ng condition nung time na yon. Nung June, so 3 people developed the disorder. And then, you have 4 in terms of prevalence kasi gumaling na si case number 2. Wala na siyang sakit nung June. Naka-recover na siya. Pero, 'di ba? Eto si case number 1, case number 3, case number 4, tsaka si case number 5. 1, 2, 3, 4. So, that's why you have 4. But since tatlo lang dyan ang new cases, kasi si case number 1 may sakit pa rin, then, yung incidence mo is 3. So, diba? So, sige. So, follow me. Sa July, for the month of July, so, eto na yung last na month ni case number 1. Medyo pagaling na, pero may sakit pa. And then, si case number 3, meron pa rin, pero pagaling na rin. And then, si case number 5 is also there. And then, si case number 4, medyo tagal-tagal pa. So, you have 1, 2, 3, 4, and then next, nag-develop ng sakit si case number 6. So, you have 5 people, okay, na may sakit. But, because 1 lang ang new case for the month of July, your incidence is just 1. Okay? Ba yan? And then, for August, ano ba nangyari? Ba't naputol? Naputol yata. Sorry. So, you have 0 ang incidence because you don't have any new cases. But, one of these is supposed to reach dito eh. Sorry. Naputol na. Pero, in prevalence, in this case, you have 1 and you have 2. So, you only have 2 there. So, please correct this one. I will correct it na lang para ching. Okay. So, right? So, you have 2 cases for that month. Okay? So, clear na how to differentiate between the two? Okay? Sige. So, here are other terms. So, when you read the DSM especially, or when we discuss yung course, yung paano mag-start yung disorder, then we need to understand the terms course and onset. So, when you say course, it's yung pattern ng occurrence and development. Yeah, so some disorders are chronic, meaning they're mostly lifetime that you experience, while there are some naman na episodic siya. So, meaning, sumusulpot-sulpot, they're not always there. Okay, so sometimes may periods na clear naman, you can function very well, and then boom, biglang mag-show up na naman yung disorder. And that keeps repeating throughout life or for a certain period of time. Whereas there are those naman na conditions that are called time limited. So meaning you experience something but then you don't need to go to formal treatments to get them, to clear them out of you. They can heal on their own. Okay? And then in terms of onset, there are those na acute ang onset, meaning biglaan. So for example, an example of this would be delirium. So parang gulat ka na lang, parang disoriented na yung person, di na makakapag-concentrate, di na makapagsalita ng maayos. Okay? Whereas, meron namang iba na insidious ang onset. So, it creeps up on you. Parang insidious na movie. So, it creeps up on you and you don't notice na the person might be developing symptoms na pala. Okay? And then, of course, the next one is prognosis. So, prognosis, usually, like, for example, if you're a medical doctor or a psychologist will ask you, what's your prognosis of the case? Okay, so you'd say something like, oh, the prognosis is good. Even with an acute onset, this disorder runs a time-limited course. So, what does that mean? Prognosis is good. Biglaan nag-start. Okay, and time-limited siya. So, it's going to improve eventually. Mawawala lang siya. Okay? Or, the prognosis is good. You can say na, very cooperative kasi yung personality ng person and very open naman sila for treatment. Yung family niya is supportive and medyo they can afford the medication. So what are you saying here? You're saying when you're talking about prognosis, what is the likelihood that the person will recover from the condition? Okay? So the next one of the big terms natin in psychopathology is diagnosis. So it's a label for a syndrome assigned to a person experiencing a set of symptoms. So it's based on a classification system. So we use two classification systems. We have the DSM, which is by the American Psychiatric Association. Okay, so in psych, ito yung Biblia. But we also have the option of using the ICD-10, the International Statistical Classification of Diseases and Health Problems. So sa ICD, actually, it covers even mga non-psychological or non-mental disorder na mga sakit. Pero basically we have a chapter there for us, for the disorders, mental health problems, and this is by the World Health Organization. But for the undergrad ng psych, we mainly study the DSM, and the DSM is now in the 5th edition, in the 5th version. Okay, so yeah, so you have another worksheet. So this is part 2 of your worksheet. So you just do this, and that's pretty much the coverage of introduction to abnormal psychology. Thanks for watching, and I hope I've helped you understand the topic a bit more.